What are the signs and symptoms of implantation bleeding on a pad?
Hello everyone. Today, we're going to delve into a common topic for those trying to conceive: implantation bleeding. This is a process that can cause a bit of confusion, especially when it comes to distinguishing it from the start of a regular menstrual cycle. By identifying certain signs and symptoms, we can better understand implantation bleeding.
What is implantation bleeding?
Firstly, it's important to understand what implantation bleeding is. This is a small amount of bleeding that can occur when a fertilized egg, or embryo, attaches to the lining of the uterus. It's usually one of the earliest signs of pregnancy, and it typically happens about 10 to 14 days after conception, close to the time of your usual menstrual period.
What does implantation bleeding look like on a pad?
Now let's focus on the main point. What are the signs and symptoms of implantation bleeding on a pad? Here's what you need to look out for. 1. Color. Implantation bleeding is usually lighter in color than regular menstrual blood. It can range from light pink to brown. 2. Quantity. The amount of bleeding is typically very small. Some people might only notice a few drops of blood or a slight colored streak on the pad. 3. Duration. Implantation bleeding doesn't last as long as a menstrual period. It can last anywhere from a few hours to a couple of days, but it's usually much shorter than your regular period. 4. No clots. In contrast to a menstrual period, implantation bleeding typically does not contain any clots. Remember, these symptoms can vary from person to person. It's also worth noting that not everyone will experience implantation bleeding.
How to differentiate implantation bleeding from a menstrual period?
Many people get confused between implantation bleeding and a regular menstrual period. Here are a few points to help you distinguish. Timing. Implantation bleeding often occurs a few days before your expected period. Bleeding pattern. A regular period usually starts light, gets heavier, and then lightens up again. Implantation bleeding is typically consistently light. Other symptoms. Alongside implantation bleeding, early signs of pregnancy like nausea, breast tenderness, and increased urination might also be experienced. In conclusion, understanding the signs and symptoms of implantation bleeding can be a key step in recognizing early pregnancy. However, it's important to note that every body is unique and these signs may not be the same for everyone. If you're unsure, consider taking a home pregnancy test or consulting with a healthcare professional. Always listen to your body and seek medical advice when needed. We hope this video has helped clear up any confusion about implantation bleeding.